If you've been struggling with chronic lower back pain to the point where you're struggling with pain for more than a couple of weeks, or maybe it's been going on for a couple of months, or even if it's something you've been dealing with on and off for a couple of years to the point where you're having a hard time just standing up straight, you're having a hard time just walking around comfortably, and for someone that's tried a lot of different therapies or treatments such as physical therapy, stretches or exercises, chiropractic adjustments, deep tissue massage, or even trying things such as anti-inflammatories or muscle relaxants, and if everything you've tried is only giving you temporary relief at best, and if over time you feel your pain or symptoms are either staying the same or just getting worse, then it might be because you're making the same mistake that I feel so many people make, which is be focusing only on treating symptoms of pain without actually understanding what could actually be causing your pain. So in this video, I want to share through 3 of what I believe are the most common underlying root causes of lower back pain that you may not be aware of. My name is Dr. Kevin Mao. I'm a physical therapist, and together with my wife Twee, we own and operate Balance and Body Restoration Physical Therapy Massage. And at our clinic, I would say that chronic lower back pain is the most common problem that we see, and also believe it's the most difficult to treat because of the fact that it's so difficult sometimes to really tell the difference between what is a symptom of a lower back pain versus what is actually an underlying root cause. So what exactly do I mean by underlying root cause of lower back pain? So what I mean by that is that there's just something that is causing pain on the lower back that just isn't coming from the lower back itself. And what makes it so hard to identify what these areas actually could be is the fact that very rarely do these areas of the body actually hurt. So what I mean by that is that when somebody's starting to experience pain in the lower back, some type of pain or some type of tightness, some type of spasm, some type of sharp pain or some type of radiating pain, obviously what most people are going to do is try to just, try to rub it out, try to stretch it out, try to maybe even do a massage or getting an adjustment or even taking ibuprofen or something like that. And if the pain goes away and it stays away, then obviously that's a very viable and good solution. However, in a chronic pain situation where the pain just comes back, or again, if we said over time the pain is just getting worse, then we really need to learn how to be able to take a step back and try to analyze what is actually causing the pain, because whatever you're doing to try to relieve the pain just isn't working long term. So the underlying mechanism that I believe explains all of these problems is something I would call an overcompensation injury. So an overcompensation injury is an injury that develops in a part of the body because it is overcompensating for other parts of the body that just are not doing their job appropriately. Think of it like being on a group of people at work, a group of 5 people, for example, and if 4 people are just completely slacking off, and all the work is just put on that one person. And then that one person is going to be one that's going to be overstressed and overworked and overtired, and at some point is going to buckle under the stress and buckle under the pressure that it's under. And that's what we typically find for people in a chronic lower back pain situation is the lower back is the person that is doing way too much work and doing just under way too much stress. And again, that's why we feel a lot of these strategies that are targeted for lower back don't actually work, because they're actually just putting more stress and more strain on lower back. And the only way to heal in a situation like this is to be able to identify what are the groups of people or what are the groups of the body that aren't doing their job, and just to restore the function of those areas. And it's only at that point are we able to actually heal the lower back, not because we're putting more stress on lower back, but because we're taking the stress off the lower back and just redistributing it the way that it should across multiple parts of the body. So for the rest of this video, I want to share with you how to properly assess to see what other parts of the body might not actually be working, and then to share with you a couple of very simple stretches and exercises to be able to get those areas activated and start to work again. And at that point, we'll finally be able to, again, take the pressure off lower back and then create the conditions and environment to allow it to be able to heal over a long period of time. So with that said, let's get right into the first underlying root cause for today. Okay, so the first underlying root cause I'm going to talk about today are a group of muscles that I just feel are just so often ignored and overlooked by so many different doctors or even like physical therapists such as myself, in terms of being a very common underlying cause of chronic lower back pain. And the muscle groups I'm referring to are the muscles that sit in the front of the hip and the front of the thigh, also known as the quadriceps muscles. And for the sake of this video, I'm also going to include this muscle known as the tensor fascia lata and also the sartorius muscle, because I believe that all these muscles play a huge role in terms of potentially causing chronic lower back pain. And I'm going to explain why in just a second. So first off, these muscles are the muscles that we rely upon to do things like hike and bike or run and jog, squat, or be able to go up and down a flight of stairs. And because of the fact that so many people spend so much time sitting or not walking or not stretching nearly enough, then these muscles for a lot of people just have a tendency to get really tight and really short just because of just kind of disuse and just because of the angles that they put these muscles over the course of the day. What most people don't realize is what happens to muscles when they get tight. If you just pretend this muscle, this elastic band is a muscle here, is when the muscles get tight and when they get short and when they aren't stretched, is they'll start to form these kinks or these knots tied in the middle of the muscle. And we call these knots also known as trigger points, okay? So if I tied a bunch of knots in the middle of this muscle, what's going to happen to the length of the muscle? It's going to start to get shorter. And as the muscle starts to get shorter, it's going to start to pull the two attachment points close to one another. So if we just look here again at this diagram, the attachment points here for all these group of muscles actually originate in the top of our hip and the top of our pelvis, and they go all the way down towards our kneecap. So what happens is when these muscles get tight, is they'll start to contract. And as they contract, my pelvis is actually going to start to get pulled down towards my knee. My knee is going to start to get pulled up towards my pelvis, and it's going to get this kind of tightening and shortening reaction that occurs through my thighs. And what seems to happen that most people are unaware of is that as my pelvis starts to get pulled downwards forward towards my knee, I'll just show you real quick, my pelvis is going to start to enter this condition known as anterior pelvic tilt, just because of the nature of the pull of the muscle in the front of the thigh. And if you see here carefully what happens to my pelvis as it gets tipped forward, my lower back is going to start to overarch. And this overarching is what can actually cause a lot of passive stress and a lot of passive strain on the lower back itself that isn't actually coming from the lower back. It's because of the tightness in the thigh. It's because of the tightness in these quads that are being unaddressed. And for a lot of our patients, when we are actually able to identify and release their quads, it can be just an absolute game changer in terms of taking a tremendous amount of stress and strain off the lower back, sometimes within just a couple of sessions. What I want to show you next is how to just quickly assess to see how tight your quads actually are, and then show you a couple of strategies to safely release and also stretch these muscles without hurting your back. So with that said, let's get right into the next video. Okay, so the first thing I want to show you is how to do a very simple assessment to see how tight your quads may actually be, and also to show you how that might actually affect your lower back. So with us today is my wife Twee, and she's going to be helping us through some of the assessments and also some of the corrective exercises that we want to show you. So the first thing she's going to do is pull her heel towards her buttock and try to point her knee towards the ground. And you also want to make sure that she's keeping a neutral spine, which means her back is staying completely straight, and also that her belt line is also staying just kind of flat and parallel, and make sure her pelvis is not tipping forward at all, and also to make sure that she's keeping nice, good upright alignment as well. So she's doing what we would call a passing test, which means that she's able to keep her knees straight, she's able to keep her back straight, and her knees also pointing towards the ground. Let's go and reset straight. So now the goal is for you to try to replicate what Twee did, which is to try to pull your heel towards your butt and point your knee towards the ground while keeping your back straight. But if you can't even pull your heel towards your butt to begin with, if you're having a difficult time grabbing on, that is the first indicator that you do have probably some type of quad tightness or some type of knee stiffness that probably needs to be addressed. So the next thing I want to show you are a couple of the very common kind of mistakes or just kind of underlying compensatory strategies that people do with their bodies when we assess them of having really tight quads and how this actually might affect your lower back. So Tweet, go and do the one where you're leaning forward. This is the first thing that we'll see people do is when they're trying to stretch their quads. They think they're getting good stretch, but what's actually happening is that their tightness of the muscle is actually just pulling their entire upper body forward. Okay, and this can have dramatic effects on your lower back just because of the amount of pull that this muscle might be having on your entire upper body, which is then causing your lower back to have to overcompensate for that pull. So go ahead and reset and release there. Yeah, so again, if you are being pulled forward, just try to get yourself back upright and then see if you're still able to hold the same stretch. So go ahead and reset Tweed, and then show the next one. So the next problem that we see very often is when people are getting upright. Exactly, it's just their back is really overarching and they're really losing this kind of anterior, or they're really losing their pelvis. So you see her back is overarching quite a bit. Her pelvis is starting to really tip forward, and those are very common signs that the lower back is overarched and the quad just is having a hard time just kind of stretching. So go ahead and try to level everything back out. So if that is happening again, just try to level everything back out to beginning. right? And then reset. And then the last thing that seems to happen when people are trying to do everything correctly, so go ahead and do with a knee forward, is we'll commonly see this. So when the back is straight, when the pelvis is level, and when the quad is being really kind of stretched, if it's really limited, this is the most common problem that we'll see, is that the knee just can't quite get pointed towards the ground. And if this is happening to you, this is, again, a very clear sign that the quad is really tight, and it is something that we want to address, okay? And again, the end goal of all of these exercises is to be able to go and point your knee towards the ground, to be able to, again, point your knee towards the ground, be able to pull your heel towards your butt with a neutral pelvis and a straight back with also good, proper vertical alignment of your body. So that's it for the assessment. And if you find yourself are tight, or if you find yourself doing any of these common, strategies to compensate for a tight quad, then let's show you a couple of ways to actually stretch and release those muscles. Okay, let's get into the next video. Okay, so the first thing we're going to show you is how to do a proper trigger point release of your quads. And we're going to teach you how to use this using a foam roller. So a trigger point is just simply a giant knot tied in the middle of the muscle, which is something that we typically see for people who have a lot of quadriceps tightness. And the reason why we generally want to start with a trigger point release is because that will start to untie some of the knots and untie some of the kinks within the muscle, which will make it much easier for you to be able to stretch. And we're just going to give you a brief demonstration in this video. If you want a more of a comprehensive demonstration on how to do this, check out the link in the description below, where we'll teach you how to do a much more thorough release of your quads. But for the sake of this video, let's get right into a very quick demonstration. What Twee here is going to do is she's going to start on the top of her quad towards the top of the hip and the pelvis. And she's going to do a very slow scan kind of on the front of her thigh, almost towards the side here. And she's going to roll very, very slowly down her thigh. And once she starts to feel a spot that feels a lot more tighter or a lot more tender than the rest, then we want her to stop right there. So Twee, let me know when you find a spot. Okay, so once you find a spot, and again, when you start to do this technique, it will be very, very unmistakable when you find a spot, such as so. And what you want to do here is to just gradually sink more pressure into the spot, and don't try to get off of the spot as quickly as possible. And the most important thing is to make sure that you are just controlling your breathing. So Twee, make sure you take a couple nice deep breaths in and out. And as you breathe, as you learn how to just almost meditate on the spot and just try to get used to the pain, get used to the pressure, what you'll feel over time is the muscle will start to reduce in terms of pain. It will start to get a little more tolerable for you to be on the muscle. And over time, you'll actually start to feel the muscle start to soften up, as the more you try. Okay, so practice anywhere between 5 to 8 breath cycles. And once you start to feel the muscle release, and once you feel it release, go ahead and go down the quad again, and then just look for another knot and look for another trigger point once you feel like you have released the first spot. So go ahead. Perfect. And the goal is to very slowly and gradually work on the entirety of the leg muscle through here. And then once you've been able to work out all the kinks, then you should start to feel a lot less tightness within the quad, which should also help you take a lot of pressure off of your back as well. We'd also recommend doing this on the other side. And again, just have patience with this. Sometimes it takes several days, and sometimes even the course of several weeks for it to fully release. But is one of the strategies that, if you are able to practice consistently, can be an absolute game changer in terms of taking a lot of stress and pressure off of your back. So that's it for the foam roller release for your quads. So let's show you how to do a very quick stretch for your quads next. Okay, so the next exercise we want to show you is our favorite way to stretch the quads after they've been released. And this is, I believe, the most effective way to stretch your quads. That is also the safest in terms of reducing the most amount of stress off your lower back as you're stretching your quads. So the only drawback with this exercise is it does require a little bit of a setup, in the sense that we are using a yoga strap, and we're going to kind of attach the strap all the way towards the bottom of the foot. And go ahead and get into position, Twee. And we would also want to make sure that you're doing it with, oddly enough, one foot flat on the floor with the opposite knee bent, like so. Okay. And the reason why we're doing it this way is because this is going to put your back in the absolute safest position possible, and also allow you to really maximize the stretching of that quad muscle. In this case, it would be on the left side. So this is something that you can do very easily off of the edge of the bed. And if you do have a little bit of a difficult time just kind of getting the strap on your foot, you can ask somebody for help, or you can even just kind of do this with a pair of shoes, because that will also help the band just kind of stay strapped on the foot without it slipping. Okay, and the reason why this particular stretch is so nice, and this is why we prefer it so much, is because just the position, it keeps the hips and the pelvis completely locked into place, and it's going to prevent any anterior tilting of the hips, which will allow the spine to just kind of stay in a very flat and straight and neutral position. All right. A lot of people, when they do stretching of their quads, again, as we saw in the previous video, it's so easy for them to fall into that hyperextended or back bend pattern, and that is just not really, fixing any problems that we want to address. But by being in this position, this will automatically place your pelvis and your hips and your lower back in a safe position. You'll really start to feel a lot of stretch and a lot of pull of the quad muscle. So go ahead and relax, Tweet. Go ahead and bring it back. So again, so Tweet was holding the stretch for quite a bit. So we'll just kind of walk you through the stretch now that we've gone through the setup. So for a lot of people, they might start to feel some stretching, even once they've kind of entered their position here. So the important thing to do is, once you start to feel a stretch in that thigh, is just to hold that position for a couple seconds and just take a couple of nice, really deep breaths into the stretch. And after you take a couple of deep breaths on an exhale, go ahead and just try to take up some slack and just try to pull the muscle into a slightly deeper stretch, like so. Perfect. All right. And again, if you have really tight quads, this is going to be quite challenging. You're going to start to feel a lot of pull, a lot of stretch in that thigh. But as long as your back is not hurting, as long as your back is straight, and as long as you just feel that kind of stretching in the front of your thigh, then just continue with this stretch for about 8 to 10 breath cycles. And again, each time you take a nice deep breath on your exhale, just pull a little bit further into the stretch as well. Let's hold it for 3, 2, 1. All right, perfect. So that's how we stretch our quads. Would absolutely recommend doing this exercise on the other side as well. And again, if you want an even more comprehensive breakdown of how to stretch these muscles, check out the link in the description below, where we go over a more in-depth workout of how to stretch your quads. But for the sake of this video, we just wanted to highlight just our favorite stretch, just to have you have some place to start. So with that said, let's get into teaching you about the second underlying root cause next. Okay, so the second underlying cause I want to talk about today is another very common problem that we see, and this is a very tight or very stiff, restricted, immobile, and weak mid to upper back, also known as the thoracic spine. So it's a very brief outline of spine anatomy. The first 7 vertebrae are known as our cervical spine, and these are the vertebrae that make up our neck. As it sits right below are the 12 thoracic vertebrae, and this is where the mid-back comes from. This is where our ribs attach onto. This is where a lot of bending, a lot of twisting, and a lot of upper body motion, especially our shoulder mobility, is going to come from this mid-back region. And then as it sits below that are our 5 lumbar vertebrae, and this is the vertebrae of the lower back, and this is where we see people most commonly have a lot of pain and problems. And then as it sits below are our sacroiliacus. Both play somewhat of a role, but for the sake of this video, we're going to be zeroing in on the thoracic spine. So why does this thoracic spine get tight in the first place, and why does this play such an important role in potentially causing chronic lower back pain? This shouldn't come as much as a surprise to you, because a lot of people who struggle with chronic lower back pain also have really, really bad posture. And they have bad posture just because of the nature of their work, just because of the nature of modern society, with so many people spending so much time either on a computer, hunched over a desk, or kind of looking down at their phones, or just spending a lot of time driving, or anything that's going to just encourage our shoulders to slouch, or upper back to kind of enter this kind of hunchback or humpback position. And just due to the fact that this just seems to happen so slowly over such a long period of time, that people are just unaware of how bad it's actually happening. But for a lot of our patients, a lot of people that we see, I would say that most people are generally aware that their posture isn't as good as it should be, and that they are, know they need to do some work on it. But what they completely underestimate is how much having bad posture is potentially causing and creating a lot of stress on the lower back in ways that they just are not aware. And this is happening due to the lack of function of very, very important muscles that run all the way up and down our spine, known as the transversal spinalis muscle groups. And what most people are unaware of, the role that these transversal spinalis muscles actually play in terms of keeping us upright, in terms of actually being the base of muscles that essentially hold us upright over the course of the day. And why people are unaware of these muscles is the fact that these muscles are supposed to be working automatically and subconsciously in the background. Is that what people don't realize is that when you're really stiff in your mid to upper back, when your back is in a kind of flex position or just rounded shoulder, kyphotic position, then it is impossible for those muscles to actually engage the way that they need to, just because of the specific nature of how they attach between each and every vertebrae. So again, if your vertebrae are really tight and really stiff and just really rounded, those muscles just can't generate the force, they can't generate the pull to actually do their job in terms of keeping us upright. So what happens is when your back is or upper back is stuck in this kyphosis position, because those muscles are not doing their job, then in order to prevent you from just kind of leaning forward and falling flat on your face, then these lower back muscles are yet again going to be called into action to have to overwork just to overcompensate for the lack of function of all those stabilizer muscles that run up and down your spine. So however, when we actually work on trying to improve the mobility of the mid to upper back, we actually start to re-engage those muscles and just start to restore the function of those spinal stabilizer muscles up and down your spine. It's amazing to see how fast the lower back will just start to chill out, because those muscles aren't in a constant state where they're having to overcompensate and overwork, because all of the muscles in the 12 vertebrae above are actually able to do their job again. So what I want to show you next is ways so that you can easily start to assess to see how tight and how stiff you actually are in the mid to upper back, and then show you a couple of simple ways to be able to reactivate all of those spinal stabilizer muscles to help you improve your posture and also take pressure off of your lower back. So with that said, let's get right into the mid-back assessment. Okay, so the next thing I want to show you is how to do a very quick and simple assessment to see how tight or how immobile your mid to upper back actually might be. And the reason why we like this stretch so much is because it also doubles as our favorite way to actually start to open up and start to address some of these problems if you identify them as such. So we're going to be using a foam roller again. And again, if you don't have a foam roller, it's something that I think you should definitely go out and get. They're pretty cheap and they are one of the most cost-effective and one of the most important tools to be able to quickly restore range of motion in your upper back, and also kind of help us do other things as well for rehab. So what Twee here is going to do is she's going to lie on the roller, just kind of crossways like so, and she's going to place the roller just between her shoulder blades, so right in the middle of her thoracic spine, and this would be around the T6 to T8 vertebrae. And she's going to hold her hands behind her head just to support her neck, and she's also going to keep her hips on the ground as well. And what Twee's going to do here is she's going to do a very slow back bend over the roller and to try to touch her head all the way to the floor. And as you can see here, Twee is able to do so. She's got a good curvature in her upper back. She's in no pain, and she's able to touch her head easily to the ground. And that means that she is quite flexible. She has good range of motion and mobility of the mid to upper back. And if this is you when you do this, that means that congratulations, you don't have a lot of stiffness in your mid to upper back that needs attention. It's going to come back up to the starting point Twee. However, for most people that we see, especially for people that spend a lot of time sitting or just are struggling with the posture, then it usually looks something like this, where as she starts to bend backwards, go ahead and demonstrate, then a lot of people are just going to just get stuck and just kind of hit a brick wall. Sometimes just, a third of the way down, or sometimes you might feel a lot of restriction going about halfway down. And if this is happening to you, if you try to do this bend, and if again, you just feel a lot of tightness in your mid to upper back, or if you just feel like your upper back just can't quite go, then then we've found out that your mid to upper back is restricted, and we probably do need to help you open up and release some of that tension. Okay, so again, go and reset Twee, go back to the beginning. So again, so if you are trying the assessment, you feel that you just get stuck, if you just get tight, then let's show you a couple of ways that you can quickly release it within just on the roller itself. So Twee, go and bend back again. So a lot of people, again, they're going to get tight. They're going to get stuck just about, sometimes a third of the way through or about halfway through. And once you reach that point where you start to get really tight or really stiff, you can just stay there for a couple seconds. But this time, Twee, I want you to take a couple of nice deep breaths in. Deep breath in. Good. And exhale. And on your exhale, you just try to bend a little bit further down towards the ground. So this is the exercise. This is how we'll actually release it. Is once you reach that point where you get stuck, once you start to get to that point where you get tight, just stay there for a couple of seconds, take a couple of nice deep breaths in, and on your exhale, just try to go a little further. Don't try to force it. Don't try to, push through any pain, especially if you're having pain in your lower back. Just start to let gravity just slowly ease your head and start to just slowly recreate that back bending curvature of your upper back over time, and just practice it for a couple of breath cycles, maybe just 3 to 5 breath cycles. And again, on inhale, try to relax, and on your exhale, just try to go a little bit further and start to try to breach new territory. Okay, so come back up, Tweet. And then what you can also do is just also work on a spot just a little bit higher up. So Tweet, go and roll the roller up your back like so, just about there. So just kind of underneath the neck, and this would be targeting around the T1 to T5 vertebrae. So those first 5 vertebrae, they're very important. And the same thing, she's going to do the same exact thing. She's going to slowly bend backwards over the roller, try to slowly, gradually touch her head all the way towards the floor. And if she starts to get tight, if she starts to get stiff, then that's fine. Just stay right there, hold it for a couple of seconds. Take a couple of nice deep breaths in. Exhale, and just slowly allow the gravity just to pull your head and your back a little bit closer to the ground. Again, our goal is to start to slowly assess, see how tight your mid to upper back actually is, and then followed by just using this roller as a tool to start to get some of that range of motion back. Okay, so again, everything starts with having the proper range of motion in your spine, especially in this thoracic area. If you're having a lot of lower back pain and you are having a lot of tightness in this mid to upper back, then this is an absolute, essential exercise for you to start to do. Because if you want to actually start to improve your posture, if you want to wake up all of those intervertebral muscles that we just talked about that are responsible for keeping upright, if you want to get that pressure off of those constant tightness and constant muscles that are tight and spasm in your lower back, then this is the precursors to anything that we do ahead. So again, everything starts with mobility. This is the best way to both assess and also regain your mobility back. And now let's show you on our favorite ways to actually start to strengthen and reactivate some of those mid to upper back postural muscles next. Okay, so now that we've showed you how to properly increase the mobility of your mid to upper back, now let's show you a very simple way to start to activate and strengthen some of those very, very important postural muscles, those very important intervertebral muscles that will help you improve your posture, which will take a lot of stress off of your lower back. So what Twee is going to do is just to demonstrate a very common yoga pose known as the cow pose. And what she's going to do here is just to create a very small, very slight backward bending curve across her mid to upper back here, just by just dropping her chest and just trying to pretend that there is some type of a ball or some type of an object just kind of sitting right between her shoulder blades like here, and just trying to imagine that she's kind of arc around the roller through there. And go and reset to me and demonstrate a couple more times. And again, so that once we have helped you regain the motion of that backward bending across your mid to upper back, we want to teach your muscles how to also recreate that motion on its own. In the cow pose is, I feel, just one of the safest and most effective ways to actually do so. 3, 2, 1, come back up. And let's just show it one more time. Okay. Now, this is a little bit harder than it may look like, especially if you are really tight or really restricted or just haven't really activated those muscles in quite some time. But how you know you're doing this exercise correctly is if you start to feel a lot of tightness, a lot of activation, or just a lot of stimulation of the muscles right between their shoulder blades as they kind of border up and down your spine on either side. So let's just demonstrate one more time, Tweet. So look for, again, anywhere between a 5 to 10 second hold. If you're just a complete beginner, start with just 5 seconds. And if you're trying to get a little bit better, try to hold it for an additional 10 seconds. So 3, 2, 1, and reset. Okay, so that's how to do it properly, but I just want to go over real quick some of the most common mistakes that I think people make when they do this, just to make sure that, as you try to do this, that you're not, again, making these mistakes that could just completely derail any progress that you can make with an exercise like this. So Tweet, go ahead and demonstrate the wrong way. So the most common problem that we'll see is people, when they try to do this, is they will be overarching yet again through their lower back. Because they're tight, because they're restricted, because they're just unable to really activate their their upper back, they start to overcompensate from their lower back. And this is what can actually cause a lot of lower back pain, a lot of lower back spasms. And if this is something that you're doing, or if you tried something like this in the past and your lower back is just dipping and overarching, then I would absolutely just reassess to make sure that you're doing this exercise correctly. So let's just do it properly one more time, Tweet. So again, if you are prone to just overextending from your lower back, try to keep your lower back still and just try to allow all that dipping, all that extension, all that back bend to occur between those muscles of the shoulder blade, between those muscles of the mid to upper back. And if you feel that stimulation, if you feel that sensation in the mid to upper back, that's how you know you're doing it right. If you feel a lot of pressure in your lower back, especially in this kind of hinge point down and towards where the lower back starts to meet the upper back, then back off. Try to redirect your attention towards the mid to upper back, or focus on more of the range of motion mobility work that we showed you in the previous video. So that's it for the postural strengthening muscles. And again, if you're looking for a more comprehensive program, check out some of our videos in the description below, because we've got a lot more programs to help you be able to restore your posture, show you a couple more stretches that you can also focus on as well. But hope that makes sense. Hope that it helps. Now let's get into the very last underlying root cause in the next video. Okay, so the last underlying cause I want to talk about today is another group of muscles that I just feel are just often ignored and overlooked by a lot of our patients. And we see this most commonly in people who are having a hard time standing for long periods of time, people that aren't able to like stand in the kitchen for more than 30 minutes to cook dinner, people that are just having a hard time just kind of walking around for more than a couple of blocks. And the muscle group I'm referring to are the muscles in the back of our hip known as the gluteal muscles. And we often find for people that these muscles are just completely deactivated. They're very weak and just very hard to engage for people that are, again, are struggling with, again, a lot of constant and chronic lower back pain. So real quick, these muscles are the bigger muscles in there. Our gluteal muscles are known as our gluteus maximus and also our gluteus medius, and also this kind of smaller muscle known as the gluteus minimus. But I also want to highlight some of these really deep stabilizer muscles known as the external rotators. And these muscles play another very, very important role in terms of keeping our hips in a good, stable position, especially when we're in an upright or when we are trying to move and use our hip muscles. However, due to the fact that people are just literally sitting on these muscles all day long, these muscles are not being called into action. These muscles they're really hard to engage just because of the fact that we're literally sitting on them and we're not, forcing them to work on a consistent basis. So what happens is the underlying principle is just that if you don't use it, you lose it. And when these muscles aren't functioning, then these muscles are, again, not performing the function of creating stability within our hip. We're creating a lot of power or drive when we're trying to do things like walk or hike or even jog. So again, what seems to happen is the lower back muscles yet again have to overcompensate for the lack of function of these hip muscles. And when these hip muscles, again, when they're not functioning, they're also not providing a solid foundation for our pelvis, which is the foundation for our spine. And anything that has a shaky or uneven or just kind of weak foundation is obviously going to create failure for anything that sits upon that foundation. And the lower back, again, is the first kind of vulnerable area that succumbs to just kind of a poor foundation of lack of hip and glute engagement. However, the good news about this particular issue is I feel that this issue can be very, very easily reversed just through a very simple set of exercises, which I want to show you next. And so what I'm going to show you is just a couple of ways that you can both assess to see how tight or how weak those glute muscles actually are, and to try to reverse some of the bad habits that you may have formed within the relationship between your hip and your lower back muscles, that you can start to reverse some of those habits to, again, restore the normal function of those muscles to take pressure off your lower back over time. So hope this makes sense. So let's get right into the next assessment and also exercise. Okay, so the next thing we're going to show you is a very simple glute bridge exercise. And this exercise serves as both a good assessment to see how well your glutes are working or are not working, and to also help you become aware of certain bad habits or patterns that your back and your body might be doing that could actually be causing your lower back pain. And then we'll show you how to actually correct it. So Tweet, go and demonstrate a couple of glute bridges. So to perform a proper glute bridge, just simply lay on your back with your knees bent and just try to lift your hips up into the air and hold at the top for about anywhere between 5 to 10 seconds. So Tweet here is doing about a 10-second hold, but if you're just starting off, just stick with a 5-second hold, okay? So practice that a couple more times, Tweet. So again, very simple exercise. just lying on your back, lifting your hips in the air, and really try to focus on trying to squeeze those gluteal muscles. One of the funny cues that we give to people sometimes is just try to pretend you're trying to pinch like a nickel between your butt cheeks and just try to squeeze those muscles as tight as you can and hold it at the top for about 5 seconds and then come back down. And let's have you do it one more time, Tweet. So she's doing a really good job. She's doing it with perfect form, perfect technique. This is something that we both practice and train a lot. So again, she's naturally doing a good job. And what I'm going to show you next are a couple of the very common habits and patterns that people do when they have deactivated glute muscles and they have a potentially overworked or overarched back. So to go and demonstrate it with the overarched back. So the most common problem that we'll see, go and arch your back up a little bit more, is that when people try to do this exercise, if they taught it before, they're just creating way too much arch. They're creating way too much curvature from their lower back, go and come back down, instead of really driving through their glutes. So we're going to demonstrate one more time. So if you can see here, her back compared to before is really curved, it's really overarching. And for a lot of people that do this exercise, if you're feeling your back tighten, if you're feeling stress or strain in your back, then it likely because you're doing something like this, where you're just kind of lifting from your back instead of actually lifting from your glutes and from your hips. So, so to fix that, what we want to do instead is to try to, before you actually engage, before you actually lift, just flatten your spine into the floor by just tightening your abdominal muscles. By doing this, this will prevent any unnecessary backward bending or any unnecessary arching from your lower back. It'll also just keep your back in a really tight and really stable and safe position. And then from there, try to lift from your hips and try to lift from your glutes instead of from your back. And what you'll see is that you'll go up less high, but you'll feel a lot more challenge. You'll feel a lot more shakiness through your core. And you'll feel a lot more stimulation of those hip and of those gluteal muscles. And what's most important is that since your back is staying straight, you're not going to be falling into that very common pattern of overarching or overusing your back. So let's demonstrate one more time, Tweet. So again, keeping the back flat, keeping the abs tight, squeezing through the glutes, not focusing so much on the height, but more so focusing on the straightness of the back and also just the maximum activation of the glute muscles in the back of her hip. Go and come back down. So again, if for a lot of people that's just starting off, it may not look exactly how Tweed does it. So I'm just going to give you an example of what it might look like for you if you're just kind of starting off with this exercise and try and do it correctly. Okay, so go Tweed, go and demonstrate going about a third of the way up. So this is what usually happens for a patient when they're first starting to do this exercise. By keeping their back flat, by keeping their core tight, they're just barely getting off the ground, just more than like an inch or two. And some people are having difficulty just getting off the floor at all. And if that's happening to you, that's okay. The most important part about this exercise is to make sure that you are not overarching from your lower back. Instead, that you are focusing on just trying to feel and engage those gluteal muscles, which are in the back of the hip, as much as you can. Okay. It's also very common to see people when they first start to do this, they might feel a lot of cramping or even like a Charlie horse like sensation in their hamstring muscle. And if that's happening, that's okay. That's just another sign that your glutes are very weak and that your hamstrings are another group of muscles that can overcompensate for the weakness of those glutes. So if that's happening to you, then just try to ease back a little bit. Try not to go as high and just try to divert your attention and just really try to just focus on that squeezing of those glute muscles. And over time, you'll start to get a little better at this. Okay. And again, don't focus too much on height in the beginning. Go and demonstrate it properly a couple times now, Tweet. Don't focus on height in the beginning. Instead, just focus on keeping the core tight and just making sure that you're not overdoing it and just making sure that you're not overarching from your back. This might take a couple of weeks for you to get really good at, but again, this is an exercise it's so easy to do. It could potentially be very game changing for a lot of people that are struggling with a lot of glute weakness. And again, this is just one of the personal favorites for a lot of our patients who struggle with standing and walking because they really feel that it just kind of resets their body. It just takes so much pressure off the lower back. And I just feel that this is one of the most effective starter exercises for people to re-engage their glutes, to take pressure off of their lower back muscles. So I hope this helps. So let's move on to our very last exercise for today. Okay, so the last exercise we want to show you today is something we call a reverse mini lunge. So to go and demonstrate. So you're going to start with kicking her right leg back a couple feet, and her left leg's going to be forward. And she's also going to hold on to something for balance. And our goal here is just to try to create a nice neutral pelvis to work on glute activation and also to stretch the hip flexor in the front while also activating the muscles of the abdomen region as well. 3, 2, 1. Go and stand back up, reset, and let's show it to you one more time. So again, right leg back, left leg forward. And a really cool cue that seems to help for a lot of patients, especially Twee here when we were teaching her this exercise, is just to pretend that there's a rope kind of sitting in the front of your right hip and exactly just kind of pull it up and across, and that will just kind of flatten and just level out everything. And the goal with this exercise is to find this posture and to find this position where, again, we're seeing a very nice neutral horizontal pelvis through here. Her glute is staying nice and engaged. Her back is staying completely straight, and her abs are also maximally engaged. And from here, just do a slight mini bend of the right knee. And what you'll do is you'll really start to feel a lot of stretching in the muscles of the front of the hip. 3, 2, 1, reset. And again, this is just one of the best all-in-one exercises to just kind of reverse all of these issues of glute weakness, hip flexor tightness or quad tightness, abdominal weakness, or anything, any of the common problems that we typically see for people that are struggling with a lot of just chronic lower back issues. Perfect. 3, 2, 1. Good. And go and demonstrate on the other side. We really love to give this exercise for people that, for instance, aren't really able to do the glute bridge because they don't want to get on the ground. This is also a great exercise to do if you are, let's say, going on a long road trip and are just having a lot of back pain with sitting. This is one of the exercises that can really help a lot in terms of taking a lot of pressure off of your back by also just kind of stretching out those quad and hip flexor muscles while also giving those glutes a really nice kind of supercharge in terms of activation. So great job with that neutral pelvis, just a slight knee bend. You don't need to go all the way down with this. Again, this is just more of an activation exercise than it is any isolated stretch or any isolated strengthening exercise. 3, 2, 1, reset. And I just want to show you just really quickly what it looks like if you are not completely attentive to your form or technique or aren't really kind of zipping everything up completely here. So if we go and demonstrate incorrectly. So again, what we see here is when people are doing something like this and they're not paying close attention, is we'll start to see their backs are starting to arch a lot. Their hips or their pelvis is starting to really dip forward anteriorly. And again, this might look good for an untrained eye, but again, the amount of pressure this is putting on the lower back, the amount of just kind of, alignment, the misalignment that's putting onto the pelvis is something that we're trying to reduce and we're trying to avoid with an exercise like this. So let's just do it one more time to it correctly. So again, instead of having an arched back, try to keep your back straight, try to keep your hips level, and just try to really pull and zip that kind of hip and pelvis up and forward. You'll get a lot of activation through the core. And again, it feels really good just to kind of activate all the right muscles because it also takes a tremendous amount of pressure off those quads and back muscles, which again, we determine oftentimes to be the underlying root cause of pain for a lot of our patients. Again, great all-in-one exercise for people. One of our favorites, and one of the favorites, again, for a lot of our patients. They do this quite a bit when they are feeling their pain is coming back. They just do this a couple times and they're just kind of reset back to feeling good again. So hope that all this helps. Just leave a comment below if you have any questions or if you are having some positive experience with these exercises. These hopefully are designed to be able to help. And we hope to see you all again next time. Take care and have a wonderful day.